go ahead.
Gozaimasu again, and now, as they say, for something completely different. So we will talk a little bit about communication. But this work is part of the work that our team is doing around antimicrobial stewardship in the UK and internationally. And we wanted to explore some of the metrics, or the ways to measure antimicrobial use in this work. There are lots of ways internationally to measure and to benchmark antimicrobial use, because it's something that is really coming to the forefront. That's been mentioned a number of times, and there's a whole stream at the conference evaluating that and looking at that. So it's quite necessary to be able to measure. We have a saying that comes from the Greeks, that if you can't measure it, you can't monitor it. So we want to be able to monitor changes over time as we look to do a better job of being stewards of these antimicrobials. And we want to assess the impacts of policy changes. There's a lot of policy being made internationally, sometimes in the face of very little evidence base. But we want to see how these policies and how all the work that we're doing is changing antimicrobial use and antimicrobial resistance particularly. So we need to have good ways to measure the usage so that we can assess these policy changes in a robust fashion. There's also a move in many countries to benchmark farms against one another, to benchmark veterinarians against one another. We know that benchmarking inherently, as humans, we're a bit competitive. And so benchmarking helps us to use that competitive nature to help us to improve, see how I'm doing versus how you're doing, and I can do a little bit better. So when we use these metrics to benchmark, we can drive behavior change in that way. However, all of the metrics that we use have their own assumptions, have their own biases, and they each represent antimicrobial use a bit differently. So I think of it as looking through a lens. We're looking through a different lens, and we see it one way versus another lens, and we might see it a different way. So we need to understand which lens we're viewing this through. But our overriding goal in all of this should really be to reduce antimicrobial resistance. However, at the moment, there's precious little information about exactly what practices or what usages are driving resistance, although we do know that resistance is closely correlated to usage. So if we're driving usage down, hopefully we're doing as good a job as we know right now to drive resistance down or to prevent the selection of further resistance. Our team spent quite a lot of time thinking and talking about metrics and thinking about, okay, if we could come up with a perfect metric, what would it be? Well, it would need to be understandable and relevant, both to farmers who are the users of these medicines, to veterinarians who are the users and the prescribers in many countries of these medicines. They need to be able to grasp it and to understand it and to own it as their own. There needs to be clear methods of calculation so that it's very transparent to everyone how these numbers are arrived at and what they mean. This is very complex, but the more transparent and the easier we can make it, then the better that we can do in trying to translate that and work with people with these metrics. As I said, they all have assumptions, they all have biases, and some of those that we need to highlight are for a denominator in some of these metrics. We need a number of cattle, we need the weight of cattle at risk of treatment, and sometimes there's not very good information about how many cows are on my farm on a daily basis, or indeed how much my cows weigh. And we need good definitions of what a dose of antibiotic is, of what a course of antibiotics is, and not only what is written on the data sheet, but what is being used by the farmer, what is being used by the veterinarian. In order to get an accurate measure of these things, we need to we need to have good information, or at least be clear about the assumptions that we're making about this sort of information. And we would like these things to be published, transparent, open access, and the exceptions to be published as well. We consider all of it like this, except for in this country, it's a bit different. As long as that is clear, then that is okay, and we can go forward in understanding what we're using. So our team reviewed all of the metrics, possible metrics that were on the table for the UK dairy industry. There were about 17 when we broke them all down, so that's quite a lot, and quite a lot to try to include in a paper, which we've now published as an open access paper that you can read. And in this paper, we also arrived at some suggestions for UK-specific metrics. So many countries have established their own national metric, which makes it a little more difficult to compare across countries, but it does allow you to understand what usage is happening in your country and at least compare year on year in your country and hopefully drive towards responsible use in your own individual country. However, most of these metrics can be applied, although we publish them for the dairy industry, they can be applied to a number of different livestock and in fact are applied to livestock and humans in many countries. So I'll briefly summarize the 5 metrics that we looked at in this paper. The first is total milligrams, so just a total amount of weight of antibiotic that's used. It's pretty simple. There's not a denominator. There's no doses or courses to be clear about. But it's maybe not that useful because there isn't that denominator. We don't know how a bigger farm is obviously going to have more milligrams of usage, but we can't tell if that's good or not and measure it against a smaller farm. So we go to something like milligrams per kilogram or milligrams per population corrected unit per PCU, which assumes an amount of kilogram of cow. And this takes into account the weight of cattle at risk of treatment, which is often standardized. Across Europe, we've come up with a standard weight of treatment of a dairy cow for across Europe, but you can agree or disagree with that, but that's very clear of how that metric is arrived at. Then we move on to the dose metrics, the daily dose metrics. This is easy to conceive because it's really thinking about how many days in a year is a cow under treatment. And that's something I can think about as a person. How many days in the last year did I take antibiotics? That kind of makes sense to me. And we can make these doses specific to the country, so they can be altered to the country's situation, but they rely a bit on the pharmacokinetic assumptions. How long does that medicine hang around in the body? How long is it doing its work? So we need to know a little bit about pharmacokinetics to arrive at these. Similarly, we have course dose metrics, so how long is a course? How many courses has that cow had? And that has similar characteristics to the daily dose metrics. You can make them specific for the country, the number of courses that are usually used, or the farm, and they depend on the pharmacokinetics. There's another metric that we reviewed in this paper that is a UK-derived metric called cow calculated course. And something that this metric does a bit differently is it separates out young stock from adult animals by the medicine. So by thinking about, okay, most long-acting macrolides for respiratory disease are used in young stock, so we consider all of those medicines young stock medicines. That's an assumption that's very clear, but you might not agree with it. Sometimes you use long-acting macrolides in adult cattle. So that may not work for you in that metric. But that was a metric that was in common use in the UK, so we felt it necessary to review it. And this graphic just shows us a little bit about how the usefulness of these metrics requires good data and requires sometimes very granular data. So looking specifically at the daily dose or the daily course dose metrics, we can see that there are different ways to define these doses. So the European Surveillance of Veterinary Consumption Group has established specific courses and specific doses that they say across Europe are representative of what happens across Europe. But we know when we look at the UK situation, for instance, sometimes those doses are a tenfold difference from what is on the data sheet in the UK. So if we want a more specific dose, daily dose for the UK, we need to use what is on the UK data sheet, not what's an average of across Europe. Similarly, if we wanted a daily dose that was right for that farm or that veterinary practice, if you always used a medicine at this certain dose rate, then you could use that more granular information. So you can see as we go from the left to the right in this figure, you need more information, but you get a more accurate representation of the usage of the metrics on that unit. Similarly with cattle weight, again, across Europe, they've determined that the average weight of risk of treatment of a dairy cow is about 425 kilos, but you may know the average in your country of dairy cow weights. You may know a breed-specific weight or an age-specific weight on your individual farm that you could use to get a better picture of the usage on that individual unit. I mentioned that we often use these metrics for benchmarking, and we put together a figure here that might be difficult to see, but at the top two graphs are of milligrams per kilogram of usage. Then we have the daily doses at the European level, at the UK level, and at an individual farm level. So for the farms we use for this analysis, we did have very granular data about exactly how medicines are being used on that farm. And then similarly, the last three graphs are daily course dose at the European level, the UK level, and the farm level. So we can compare those. And what you can see in this graph is the different farms are colored differently, and they move around. Sometimes the one farm is highest for some European dosages, but when we look at the farm dosage, it's in the middle, the blue farm, for instance. So the farms do move around. And something else that I need to say is that the graphs on the right are just about the highest priority critically important antimicrobials, which the European Medicines Agency considers to be third and fourth generation cephalosporins and fluoroquinolones. And we believe that those should always be benchmarked separately. If we use something like milligrams or milligrams per kilogram, and you were just trying to lower your milligrams per kilogram to the lowest possible, if you use fluoroquinolones, you have very low milligrams. But we think that it's important to not use these highest priority critically important antimicrobials, so we would like to see those benchmarked and considered separately from the overall antimicrobial use, so that we can ensure that we're not using this lens of milligrams per kilogram and just driving towards usage of drugs that really make more of a difference in the human population, that may lead to more resistance in the human population. So many ways to benchmark these, many ways to see, and you can see from the picture that there are different, the farms are represented differently depending on the lens through which we view antimicrobial use. Hence, it's important to understand what we're viewing. We've also done some work, and I encourage you to go to Lisa Morgan's talk tomorrow and on Saturday about some of the work she's been doing with farmers and participatory groups, getting farmers to focus on their antimicrobial use. We asked them, what sort of metrics do you like? We gave them this host of metrics and said, what makes sense to you? What do you want to use on your farms? And we found that they wanted to understand in depth these limitations, these benefits. If they're going to be compared against each other on these metrics, they want to know what it is exactly that they're being compared on. They liked ones that were specific for their own country and specific for their own farm. They liked things like pence per liter of usage of antimicrobials, so that they had some economic understanding. And we heard Christian Sharpenziel yesterday talking about selective dry cow therapy and the economic reasons why that works well. So farmers did really appreciate that. They did like that cow calculated course where we split out young stock, we split out adult cattle, so they could see where the pinch points are. What are the problems? When am I using the most antibiotic? They really liked to be able to be a bit more specific and refined about that. They were very hungry for knowledge about these highest priority critically important antimicrobials. They wanted to know a lot more. And in fact, they wanted to have a lot of time, and Lisa, as a PhD student, spent a lot of time speaking with those farmers about antimicrobial use, conversations that they hadn't had with their veterinarian. So we really feel like it's important, and there's a wide open door for veterinarians to go and talk to their farmers about antimicrobial use, about antimicrobial resistance. They're hearing about it on the news. They're thinking about it when they go to their doctor, when they're in the hospital or a family member is in the hospital, and they know it relates to the health of their animals as well. So there's a lot of room to speak about that with them. Just a couple of points to keep in mind. If you have rubbish data, you're going to get rubbish metrics. So if your only data looks like that on the right-hand side of the screen, it's very difficult to translate that into a very good and believable metric. You also need to have a standardized list of products across your country. So our group, in doing some of this work for a number of our projects, brought together a standardized use so that that can be used across the UK. So it's important to know what products are out there that you maybe never knew, never heard of, and maybe is being used off license by veterinarians, and to be able to consider those as well. So we did recommend that the UK establishes specific daily dose and daily course dose metrics for that country. And this needs things like publication of the standard daily doses. So again, what's on the data sheet, is that freely available? How do we know? That's been done for human medicine in the UK, and they use daily doses for human medicine. So can we do the same for animals? But then it begs the question, what are veterinarians prescribing? What are farmers using? And some of our work shows that some farmers will put 2 tubes in a big cow's udder because she needs more antibiotic. So if you're benchmarking them on 1 tube usage, because that's your assumed usage, and they're using 2 tubes, what's happening to their value? So we need to understand better what veterinarians are prescribing and what farmers are using. We do have a new project with our levy board ongoing to look at benchmarking within the beef population in the UK, which Sarah already told us is quite complicated. So we figure if we had 17 metrics in dairy, we multiply that by at least 5 for beef for the possibilities. So that makes a very big table that I can't even comprehend. So there's a lot of work to be done in that realm as well. And we have another ongoing project that's looking at the actual numbers of farmer-reported beef cattle on their farm versus the official numbers, so that we have some sense of how good our farmers at reporting the numbers, how good is the official data with keeping up with the numbers the farmers have. And we're doing this in order to put together a research database so that we can combine information about antimicrobial usage, antimicrobial resistance, and the risk factors that exist, so that we can answer some of these One Health questions about antimicrobial resistance. We're also including human data in there about usage and about resistance, so that we can see the transmission pathways and we can really see what's the relationship between what's being used in livestock and what is happening in the human population. I have to mention communication a little bit, and farmers, as I said, do really want to engage on this with their veterinarians, so we're also, based on the motivational interviewing methodology, producing a communication tool that veterinarians can sit down with their farmers and listen to what the farmers' needs are and understand why they're using some of these antibiotics and how they're using them. So be on the lookout for that as well, so we can improve antimicrobial stewardship. So a lot of work going on at the University of Bristol. If you want to follow us on Twitter, AMR Force, all of the people that have funding and are collaborating along with us on this work and the exciting path towards better antimicrobial stewardship. ありがとうございます。